And today we'll basically go to now the proper introduction. I believe you are able to see my screen. Are you?
Yes.
Okay, good. Just hold on a minute. Let me just get something. Just hold on. Yes. So today I want us to talk about we'll introduce ourselves to medical surgical nursing, what it is, including discussing the nursing process. Before now, we can go to the actual conditions. So, introduction to medical surgical nursing, where we'll talk about the various the definition, the scope, the various concepts of health and illness, and then the nursing process. That's what is going to inform our introduction before we can go now to the actual discussion of the conditions. So at the end of it, we should be able to define what medical surgical nursing is. The scope of the medical surgical nursing, we should be in a position to discuss that. We should be in a position to discuss the concept of health and the concept of illness, which I know you have done from your fundamentals of nursing. And lastly, we should be in a position to discuss the nursing process. So, like I said when I was introducing the course last week, medical surgical nursing, we are talking about care that is provided to adult patients. And these are patients whose diseases, whose conditions we should be able to manage medically, we should be able to manage pharmacologically, and or we should be able to manage surgically. So basically, medical surgical nursing, we look at the whole spectrum of healthcare interventions that are given to patients who come in with diseases of any form who may require any form of intervention, be it medical intervention, pharmacological intervention, or surgical intervention. We should be in a position to provide that. So can also be defined as the diagnosis and treatment of human responses of individuals and groups to actual or potential health problems. From fundamentals of nursing, I know you were able to discuss what actual health problems are and the potential health problems. The actual ones, those that the patient is presenting at the point of coming to seek medical intervention. Potential are those you may be able to identify in the process of now assessing your patient. Now, its scope is wide. We look at what is this that covers the area of medical surgical nursing, but somebody says Madiro says she cannot see the slides. I'm able to see on my end. How about the rest of the guys? Are you able to see the slides?
Yes.
Yes, Mary. People are able to see the slides. Maybe you can try to leave and then rejoin, because I'm also able to see that the slides are visible. Thank you. So the major goal of medical surgical nursing is there just to assist you as the healthcare provider to promote, restore, and maintain optimal health for your patients. So, as that medical surgical nurse, you should be able to be skilled. Remember last time I said the KSA, the knowledge, skills, and attitude. So you should be able to be skilled in doing proper assessment, proper diagnosis, and now the actual treatment or managing potential alterations in the functional ability of the patient and their lifestyle. That's why last week I mentioned to you that you should be in a position to enhance your, or you need to go back and read on your nursing process, understand the nursing process, and not just understanding the theoretical aspect of it, but now utilizing it in a practical setup. That's the only way now you can be able to succeed in now managing patients within a medical surgical setup. The medical surgical, I mentioned this, we are talking about adult nursing. So the clients here we are talking about are the adolescents all through the lifespan, which now talks about these patients. So, uh, so MedSurg is practiced in a variety of settings across that continuum of care. And there's so many settings. That's why I said MedSurg is one of those, or is the mother of all those specialties of nursing, because of the setup even in which it is practiced. Can talk about acute and subacute care facilities. MedSurg is practiced there. Home care agencies, ambulatory care clinics, outpatients, residential facilities, skilled nursing facilities, private practice, adult agencies, primary care and specialty practices, schools, insurance companies, private companies. All these are setups in which you can practice the medical and surgical nursing. So let's talk about health and illness. I believe you've already discussed this. What health is, the absence of disease. You've had all those definitions to health. You have all those definitions to illnesses, which have been discussed by Dr. Namsonge in your fundamentals of nursing. So, health, that absence of disease. And disease is that deviation from the normal biochemical concept. It's very dynamic, and presents with that dynamic equilibrium between man and his environment. And animal adjustment is what brings about diseases, and this is what we are going to manage. Go back to your nursing theories, Nightingale theory, environmental theory. We're talking about state of well-being, and using every power an individual has, to the fullest extent to promote their well-being. If you go to the World Health Organization, that complete physical, mental, and social well-being, and it's not just merely the absence of disease. It one can have, there can be the absence of disease, but again, the physical well-being, the social well-being, the mental well-being of an individual can have an effect on a state of malalignment misbalance that can bring about disease. So all these are components that we look at when taking care of patients. That's why as nurses, we don't, just from that definition alone, it tells us we don't just focus on the disease. We talk about providing holistic care to our patients. We look at this patient as a whole. We focus on the disease. We focus on the physical well-being of the patient, the social well-being, the spiritual well-being, the mental well-being. All those because they have a direct effect on the state of well-being of a patient. Various models of health and illness, which you've talked about, I'm sure this has been discussed, various of the courses you've done thus far. Host agent environment model, where now health and illness will be dependent on the interaction of the host, the agent, and the environmental factors. When the variables now are in equilibrium, then health is maintained. But instances where now they are not in equilibrium, they are not stable, this is instability, then disease comes in. So the environment, the agent, the host, they have to be maintained in a state of equilibrium to maintain the well-being of individuals. Once this is affected, then that leads now to disease. Then the health illness continuum model, where we talk about health now being that constantly changing state, where now high level wellness is on one end and death is on the opposite end of a graduated scale or a continuum. So where now, normal health, if maintained, will lead to good health, and that means high level wellness. Where normal health is affected, illness will come in, and if there is illness coming into the body, then potentially death will come in, or complications, irreversible complications to the individual. So you can see here that wellness paradigm, where now can have premature death, or we can have high level of wellness. If it shifts to premature death, disease has come in, signs and symptoms have come in, disability, and then death. High level wellness, where now one is aware of their own health, they are well educated on their health and how to maintain their health, and that leads to growth, and that basically leads to high level wellness. So with high level wellness model, basically one has to, take care of their well-being. And the high-level wellness basically can be applied across lifespans, across families, across individuals, across communities, across societies, where now if people are well educated, awareness is created about diseases, then high-level wellness will be maintained. If this is not observed, then again now diseases will come in, signs and symptoms will present, disability will come, premature death is going to happen. So with the high level wellness now, it views human beings in various aspects. One, each individual is functioning as total personality, as individual personalities. That means they have individual control over their well-being. Each person possesses dynamic energy that is very much individualistic, very much personalized to that particular individual. Each individual is at peace with in and outer worlds. We have control to have that, the control of what happens inside us and outside our surroundings. We all have that power over the control of that. Each person has a relationship between energy use and self-integration, how to balance the two. We all have inner worlds and outer worlds, again, which I've said we have control over. Then we have another model, the dance high level wellness and the grid model, which again now classifies health in various quadrants. Quadrant 1, where we have high level wellness in a favorable environment. The second one, protected poor health in an unfavorable environment where one has disease. But again, the disease process is within manageable grounds where one has control over it. Then we have poor health in unfavorable environment. So there is poor health in the body, and again, the environment does not allow even one to have control over that poor health, which could be as a result of uh, challenges with accessibility to quality health, financial implications of health, lack of um, skilled personnel, lack of equipment to do proper diagnosis. All that will be fall there, and this affects most of the populations within our country. Then you have imagined high level wellness in an unfavorable environment where one wants to take care of their health, their well-being. They are willing and they are aware of how to take care of that. But then the environment does not allow them to maximize what they have to its full potential for their own well-being. The health belief model, which is a theory, which basically relies on the three components of perceived susceptibility to a disease, perceived seriousness of a disease, and perceived value action. So, of course, the perceived, it looks at individual perception. How much am I susceptible to a given disease? How does this susceptibility create threat of a disease to me? Now, what are those modifying factors within my control that I can maximize on to maintain good health? What are those changes, behavioral changes that I'm able to have control over? That's in terms of the actions to mitigate the susceptibility to a given disease. That is the health belief model. All those models just try to explain what health is and what disease is. Any question to that point? Any question? Okay, then you can proceed to nursing process. Can proceed to nursing process, which again, I'm aware you guys have done nursing process. We look at the nursing process, the purpose, characteristics, and the components of nursing process, which we are all aware of. What is the nursing process? Somebody to tell us what nursing process is. Somebody to try to define for us nursing process. Somebody to define for us nursing process.
It is the systematic patient-centered care that is used to plan and deliver care. Yeah.
So the systematic process is utilized to provide care to patients. Correct. So it has to be very systematic, organized, systematic, and deliberate approach to which now nursing care is provided to the patient and their families. And what we are aiming here is just to improve the standards and the quality of care that is provided to our patients. It's very holistic. That means that it looks at the patient as a whole. So we don't just look at the disease process itself, but we'll look at this individual as a whole, as a human being, as a whole human being. So it is holistic, it's interactive, because you have to engage with the patient. You have to create rapport with your patient for you to get necessary information, which is going to assist you to give care to this patient. So it has to be very interactive for you to now achieve patient-centered nursing interventions. If you don't interact with the patient, you don't engage the patient, you don't share with the patient, you don't talk to the patient, you cannot get necessary information that you require to, come up with the correct nursing diagnosis through which now you want to go flow through the whole process. Remember, I told that to you guys last week, that you have to get it right from the assessment phase. You have to get it right. So if you don't get it right at assessment phase, then everything else that follows just becomes wrong. So that's why it's important. You have to take time with your patients, talk to them, engage them. And the sharing you have should not just be limited to focusing on the disease. Focus on the individual as a person, on the various aspects, the physical, the social, the psychological, the mental, the spiritual aspects. All those are aspects that you put your emphasis on. So we have defined that systematic interactive approach. It has that series of planned steps and actions which help now to solve problems of people and the significant others, that is the caregivers. Very organized, goal-oriented. It has that humanistic care. That's why you have to be emphatic, feel yourself in the shoes of this patient, even as you go through that. Nursing process, the cornerstone of nursing profession. You cannot practice nursing, like I mentioned. As you cannot practice nursing if you are not competent and adequately grounded on the nursing process. Nursing process is what makes great nurses. So if you want to become a great nurse, just make sure that nursing process is your good friend. Its purpose helps to identify the healthcare needs of our patients, establishes a nursing care plan so as we are able to meet those needs, gives scientific-based, holistic, and individualized care to the patients. Remember, I mentioned that last week. I wrote in your class, evidence-based practice. That's what we talk about here, scientific-based. Anything that you do, there has to be a rationale to it. There has to be an explanation to it. It gives you that opportunity now to work collaboratively with the patients and others, because if you cannot work with the patients, with others, the caregivers, and other healthcare professionals, you cannot be able to get it right in the nursing process. And nursing process actually gives you now that opportunity. It allows you now to engage these people, achieve continuity of care, because it's very systematic. That allows continuity of care, because anybody who comes after you to continue to pick up care from where you left, the nursing process allows them now, because they are able to see this is what has been done thus far, this is what has been done, blah, 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 blah. And from there, they are able to pick, because the cues already show what was picked from the patient. Encourages the healthcare team to observe and interact with the patient, not just, the task of administering an injection, dressing, change, and bath. It's very important. You have those people who don't talk to patients, those people who don't engage patients, who go to the hospital. Your responsibility is limited to just get there, do morning care, do bed making, from there give medication, document, and your work has ended. If they want to be dressed, dress, and that is it. You are not a nurse, and you're not supposed to be in nursing school. You have to interact with the patient continuously, because the patient's needs keep on changing, keep on evolving. So you have to continuously keep them talking to them. It will give you very vital and useful information. Create that roadmap that ensures good nursing care and the better patient outcomes are achieved, because it's very systematic, very progressive. So it now plans for you the nursing care that is going to be provided. And if it's adhered to, then you will definitely have good patient outcomes. But if you did wrongly, then you will be sure to get wrong patient outcomes. Some of its characteristics, which I know that again, you've discussed this. I'm going a bit fast because this has been it has been discussed by Dr. Namsonge. Problem oriented because it focuses on the problem of the patient. Goal oriented because you set goals. When you plan, you are setting goals and you evaluate, you intervene and then evaluate this goal. So it's very much goal oriented, orderly, systematic. We've just mentioned that. It's open to accepting new information during its application. You may collect information, assessment phase, come up with the diagnosis plan, start intervening. In the process of intervening, some new information comes to your knowledge. The nursing process allows you to adjust whatever you are doing to also meet or to also cater for or bring on board the new information that you have identified. So it's not cast on stone. Interpersonal, there has to be communication between you, the patient, the other nurses, the medical officers, the clinicians, the lab people, the pharmacists. It creates that avenue for that interaction. It encourages creativity among nurses and clients. That's why I was mentioning to you, nursing being an art and a science. So sometimes the nursing process allows you to just be creative for you to optimize the care that you provide to your patients. You have to have very creative, identify resources, create resources that is going to assist you to take care of the patient. Universal, it is applicable everywhere. Be it you are managing an individual, be it you are managing a family, be it you are managing communities. If you are in Kenya or you are in the US or you are in UK, you are in Malaysia or whatever it is the same. Nursing process is the same. It never changes. Be it you are applying it using whichever language you want to apply using, it allows you to do that, and still it remains to be that nursing process. Its benefits to the patient, first and foremost, it allows now the patient to receive quality nursing care. Because now already you have identified the patient's needs. Now you have to systematically provide solutions to the patient's needs. But imagine in the absence of nursing process, you could just be giving interventions to whatever comes to your knowledge. And that care could not be systematic, and that could bring about compromised care that will be provided to the patient. There is continuity of care. I've just mentioned this. Reduces the incidence of hospital care, hospital stay, because the patient is receiving quality care. So that reduces the amount of time the patient spends in the hospital. If it's not being utilized, it prolongs the patient stay in the hospital. There is the patient participation aspect, because the patient needs to be given that human dignity, where they are also part and parcel of the process of their care, of their well-being. So they need to also feel like they are part of that process. And the nursing process permits that. It allows you now for the patient to be part of that process. Benefits of the nursing process: it's consistent and systematic. There is job satisfaction, because as a nurse, once you do that, you'll be satisfied. You've done the correct thing. But if you go caring for patients, not utilizing the nursing process, you will actually run around the ward the whole day, and at the end of the day, you realize you've done nothing. There is professional development, because it allows for new learnings, for growth. avoidance of legal action. You can see when it's highlighted in red. Because with the nursing process now, it allows documentation. It basically very systematic and procedural. So anybody who wants to come and find out, they are able to see. You did the assessment. This was your, the issues you identified, and this how they were attended to. It allows you for that, and it reduces the risk of legal action. It meets the Code of Ethics and Professional Nursing Standards. It professionalizes the profession, speed up diagnosis and treatment of actual potential health problems, because now nursing process allows you to quickly come up with a diagnosis, quickly identify patient problems, and make the necessary interventions. Promotes flexibility and independent thinking, because now one becomes flexible, one becomes an independent thinker who is able now to uh, think on their own through that systematic approach that they are going to utilize. And flexibility, it allows you to change. It's not cast on stone, like I've just said. The phases of the nursing process, I believe we know them, right? The phases of the nursing process. Who can tell us? The phases. Yes.
So I think we have assessment, nursing diagnosis, planning, implementation, and evaluation.
Assessment, diagnosis, planning, implementation, and evaluation. Okay, correct. So, assessment. Let me ask Crispin Barasa. What's assessment? Something about
Assessment.
assessment.
So about assessment, this is where now the nurse engages with the patient to collect data, where we have the subjective data and objective data. First, we collect the subjective data where we collect the symptoms. An example is when the patient reports that he or she feels pain. That is something that is subjective. And objective, that is something that we can measure. For example, while measuring vital signs, and followed by the physical examinations. Yeah, that's all about the assessment.
Okay, that's assessment. Marion Induta, diagnosis. Something about diagnosis. Marion Induta. And Mark, you, if I call your name and you don't, I'll let Chris to know that you are supposed to be marked absent. So Marion Induta for the last time. Yes, these are
Present.
things you've done. Yes. Yes, Marion. So I've noted that. I've noted that you're not in class.
I'm in class.
So can you respond to my question? These, these are things you've done. You have to say something that will make me know that you are with me. Not just by saying you are in class. So I've noted that as an absence from class. The couples. The couples. Good morning. So identify the actual or potential health problems according to the data that you have uh, collected. Stella Chepkoech, planning. Stella?
This is the
Yes.
it's a process of identifying the nature and the cause of a disease or a
Sorry?
health problem by
Planning?
a person
Come again?
examining some of the symptoms, the signs and the medical history of the patient or the client.
What are you trying to explain, Stella? Which phase?
Planning involves the steps taken by a nurse to prepare the
Sorry? I'm having two different people speak. The first person who spoke and the second person are two different people. I was on Stella Chepkoech.
planning is the stage where the nurse gets to
Stella, we can't hear you. Okay.
planning is the stage taken by a nurse to ensure implementation of proper goals so that to improve on patient's outcome concerning the patient's health.
So where do we get these goals from? What you just read for us?
No? You plan according to the diagnosis, to the nursing diagnosis.
Aaron Kipto, planning. Aaron Kipto. Aaron Kipto. Okay. I'll mark that as an absent for today's class. Glorious Signorera. Planning, something about planning.
Okay, planning refers to developing an individualized care plan based on the nursing diagnosis.
Okay, that's great. Uh, let me have Ashley or Uma talk about implementation. Ashley or Uma. Ashley.
Yes.
Implementation.
Implementation is where we put nursing plan into action.
Then Paul Kabjumba, evaluation.
Good morning. Evaluation, we assess the patient's state after implementing whatever we planned to see if it has worked or not worked.
Okay. So evaluating the patient's response to those interventions. These ones are things that are in your fingertips. I don't know why I ask somebody a question and you take forever to respond, and you have these notes you have been taught. So nursing process and its components, assessment, diagnosis, planning, implementation, evaluation. So you can say that the nursing process, is just dynamic. It keeps on just going around. Start from your assessment, diagnosis, planning, implementation. You evaluate. Once you evaluate if you have achieved your goals, you exit. If you have not achieved your goals, it's an important again, you go back to your assessment. So the assessment, which talked about that collection of the data, be it subjective, be it objective data, both of them very important because now they help you to determine the patient's health status, identify those actual potential health problem, and it's the very first step of the nursing process. So it helps you now to collect the data, validate that data. How do you validate the data? Joshua Kimtai. Joshua, how do you validate?
Urudie tu kiasi sikuelewa.
The nursing process, like I've just said, is part of the first step of the nursing process where you collect the data, then validate the data. I'm asking you, how do you validate the data that you've collected? How do you validate? If you don't respond to me, I mark to you are absent from class. Okay, let's go to the next person. So that's an absence from class. I've noted that down. Itoto, how do you validate the data? How do you validate? Itoto, how do you validate? You're not even in class. So that's an absence.
By cross-checking.
By doing what?
By cross-checking the data.
Apart from cross-checking.
and looking for the accuracy.
Anybody else? Anybody else wants to respond to that?
You can compare what the patient is saying to what you can see by yourself.
Exactly, comparisons. Another person?
Good morning. You can carry out tests to confirm your observations.
Carrying out tests. Mwingine ongea tu. I cannot see who is raising their hand.
It's according to me, validating the data ni kama you have just collected the patient that I'm feeling maybe fever, high temperatures in the body. So you take the measurements, then you confirm like doses you've just gotten from the measurements and compared to what the patient has told you.
Okay, though you are breaking. Yeah, so these are the various ways you can validate the data, compare the subjective and objective data. You know, for example, you are attending to a patient, and patient tells you, I don't have pain, or I'm not feeling any pain. But from their facial expression, the patient looks tense, or they're regarding their abdomen, or, facial expressions clearly indicate that they're in pain. I mean, that alone should be able to tell you that whatever the patient is telling you subjectively is not the right one, So that's one way of validation, comparing the subjective and objective data. Seeking clarification from ambiguous statements or vague statements. Sometimes patient may tell you statements that may seem vague, or they're not making sense to you. So, seek clarity on those statements. Verify with additional observations. Maybe you reject the abnormal findings. Like now, for example, you've done your blood pressure taking, and you find out that it's very low, or it's very high, or it's giving an abnormal finding. You repeat. That is validation. Use others. You can use family members, caregivers, from the medical records, from previous healthcare providers. Those are going to give you additional information across time. See if they're remaining the same, or they keep on changing at different validation. So you validate, you organize, then you record that data. So assessing data collection through physical examination, which will help you now to pick baseline data from laboratory records of the patient, the nursing records, reading relevant literature on what the patient is presenting with. Input from family and significant others are part of where you can use to assess your patient. You can design a nursing assessment tool, which will help you to collect information. You can use the various theories, nursing theories, just to collect information. Primary sources of information from the patient, secondary sources from other people. The two categories of data, don't have to talk about that. The subjective and objective data. Subjective, patient's opinion, their feelings about what's happening to them. Subjective, those measurable and observable pieces of information that will give you information about the health of the patient. I don't have to talk about subjective, objective. These are things that you people have done. I don't have to really talk about that. Methods of data collection, observation, which relies on the use of the 5 senses. You touch, you see, you hear, you smell, you taste. That can help you. The health interview, which again is a very good tool of, soliciting information from the patient. And that helps you to collect, of course, the nursing history. Physical examination, head to toe examination should be help you to give you information. The second step of nursing diagnosis, the nursing process, the nursing diagnosis, where now you come up with a clinical judgment about the individual, about the family, about the community. And now this is in response to the actual and potential problems you may have identified. And the nursing process now is going to give you the health needs of the patient. We have various steps of nursing diagnosis. Don't talk about that. The actual potential and the wellness nursing diagnosis. The actual nursing diagnosis, what is present at the time of assessment. The risk nursing diagnosis, problem does not exist, but there are factors that are present that are likely to trigger the problem. Wellness diagnosis, which helps to describe now how one is ready to respond to various levels of wellness within the family. Post-born nursing diagnosis, where there's further clarity may be needed to support or to refute that nursing diagnosis. The syndrome nursing diagnosis, where you are talking about a cluster of other nursing diagnoses. Those are examples. I want to give that again. We will come, I think this ones I'll come to class, and again we'll now physical class. We'll still want to repeat this. I want you to go back, read, and try to come up with nursing diagnosis, formulate nursing diagnosis, create scenarios for us so that they can help us to know how to formulate nursing diagnosis. Formulating nursing diagnosis, usually we follow the PES, the problem, the etiology, and then the sign and symptom. Problem, that is statement of the client's response. That's the NANDA label. I believe you people have NANDA. Do you know what NANDA is? Do you know what NANDA is? Someone? Someone who knows what NANDA is? Someone who knows what NANDA is? Oh, wow. Hii sasa itabidi to now NANDA, that is the North American Nursing Diagnosis. North American Nursing Diagnosis is the one that is used to come up or give you diagnostic labels. Now, work for you, an assignment for everybody.